I certainly did. I want to bring in a Republican Congressman, Mark Amodei of Nevada, who serves on the Appropriations Committee. Congressman, welcome. Thank you for being here. You have to talk to your constituents about this. I'm hoping you read the CBO score. We are agreed, right, that health care premiums are not going down under Obamacare, nor are they going down under this bill.
I think that's a correct statement, Ali.
You said on Monday that if you had to vote on the health care bill right now, you'd vote no. Tell me what your concerns are.
Well, Ali, I'm a process guy, and we've heard a lot of talk about regular order and committees and stuff like that, but I would just say a couple of things. One is a committee meeting without witnesses, those are stakeholders, omits part of regular order. We need to hear from people who are not members of Congress, who are not staffs of Congress, who are not employees of the federal government supporting the Congress or the administration. You need to hear from insurance companies, you need to hear from retired people, you need to hear from hospitals, you need to hear from doctors, and on and on. And one of the committee meetings that I think has been omitted that would be incredibly helpful is let's call the insurance companies in on the record and ask them, what do we need to do to lower health care premiums so that you can have somebody on the record?
Congressman, I think you sell yourself short calling yourself a process guy. You would like everybody who has something to say or contribute to this decision to be consulted on this. But one of the problems we've got in this country, and I'm focusing on you in Capitol Hill, is people get dug in on both sides of this. They want to win the battle at hand. And this isn't really about winning. For American people, this is about getting the best deal that you can get for the long term in health care.
Well, I think if you're talking about winning the issue, that's a correct statement. The problem is that we're muddying the waters with somebody being able to say they won politically. And as we know from the previous attempt 7 years ago, thinking you won politically doesn't mean that you fix the issue. And so I'm just concerned that we don't make the mistakes that were made 7 years ago.
All right, so you'd like a more thorough process with hearings, with input from professionals, from insurance companies, from medical associations. You've been getting some of that. Without the hearings, you're getting some feedback from some of those groups. Are you looking for a particular end? Do you think that there's an end that you'd like to support, or do you really want to hear from everybody and make a decision after a bill has been crafted in a more consultative way?
Well, I think, Ali, what you've got is that there's been a commitment from all the political Olympians to get something to the floor and see where it's at. And so when that happens, people like me are left with absolute uber razor-sharp focus on what the bill consists of now and can you support it. The problem without having any of those hearings, Ali, is everybody can say whatever they want. Governors aren't on the record right now. Health insurance companies aren't on the record right now. Nobody's on the record. So what we have is who can shout the loudest, for instance, as you just spoke about what the CBO score does or doesn't mean. There's way too much in this that is not. I mean, people are even talking about how it's going to change in the Senate and whether or not the Byrd rule.
Right.
And it's like, really, I'm going to go back and stand in front of the people that hired me for the 4-month period to say, well, I did it because of this or that. It's like, listen, what is the impact? Here's a question, Ali. What is the impact on Nevada, the state that I represent?
I was just going to ask you that question, so I appreciate you asking yourself the question. You have a particular problem in Nevada in that you've seen rates go up higher than the average and insurers leave at a greater rate.
Well, in 11 of the counties in Nevada, there's only one insurer right now. What I can't do as a member of Congress is pass a bill that requires an insurance company to write health policies in Nevada. So if we mess this up, they just simply leave the market. And then what are you left with? That is not reform.
Well, I hope you get your way, sir. I hope this is a more consultative process and everybody gets heard in it. Thanks so much for joining me today. We'll talk more about this. Representative Mark Amodei, Republican Congressman from Nevada.